Hello, welcome to any community. In this particular video, we are going to discuss Darshanendriyataha Pariksha, where the physician is going to use his Darshanendriya to analyze the normalities and abnormalities of the clients or patients who are visiting in his OPD or IPD or in his private clinic, etc. So, in this particular occasion, as we have discussed initially, Darshanendriya or the Chakshurindriya of the clinician or physician or surgeon is used for the assessment of the Roga Bala and Rogi Bala of the individual during the patient interaction. It may be related to nourishment status, whether he is undernourished or whether is it normally nourished or whether it is overnourishment or whether it is obese. That can be analyzed. A discoloration of the body. That means whether the person is having yellowish discoloration of the skin or sclera or the eyes, etc., or the bluish discoloration of the tongue, nose, or the eye, the hands, etc., or deformities observed. Maybe the deformities in relation to the patient suffering from rheumatoid arthritis. For example, swan neck deformity, or button ear deformity, or Z deformity, or the person is having the what do you say that the uh, this uh, this what do you say that the knock knee or curved knee, that is the genovarum or valgum deformity, etc., and measurement of the different body parts. For example, the person is having the what do you say the barrel shaped chest. The anteroposterior diameter will be almost equal to transverse diameter. In that particular situation, we need to know about the measurement of the anterior posterior diameter and transverse diameter. The person is suffering from ascites. To know about the day-to-day changes, we need to know about the measurements of the abdominal girth. In cases of the person who is suffering from the huge the knee joint swelling, to know about the progress in the treatment, we need to know about the measurements also. So, like that, the measurement of the body parts requires the what you say that the Darshanendriya itself. And regarding the normalities and abnormalities of the body and body parts, the person is running for a period of 100 meters. At that time, the development of the breathlessness by opening the mouth may be normal. Suppose if the person is walking for 100 meters and is developing the breathlessness, definitely that requires a concern uh, in case of what is say that the disturbances of cardiorespiratory function, cough, regarding the color of the sputum, etc. Whether is it whitish color or yellowish color or the greenish color, reddish color, or rusty color, etc. That will be decided by visualizing the color of the sputum by eyes. Facial grimaces, facial grimaces, in the sense, in the person is having severe pain, simple movement itself causes a severe variety of the what is a facial changes itself. That has to be noted. All these aspects can be assessed by Darshan Indriya of the clinician. Let us see what is the description that is being mentioned in the uh, our texts regarding the Darshan Indriyataha Pariksha. It is being mentioned that in case of Arunadatta commentary, Ashtanga Hridaya Sutrasthana first chapter, it says, Darshanena Drishtya Kasamehadyarteshu Pita Shukla Varna Samsthana Pramana Upachaya Chaya Vinmutra Chartitadikam. If you split this particular shloka, it is being mentioned that Darshanena Drishtya Kasa Meha Adi Arteshu Pita Shukla Varna Samsthana Pramana Upachaya Chaya Vit Smutra Chardita Adikam. So, when you are using the Darshan Indriya to analyze the patient, these are the following conditions where we are going to use the Darshan Indriya. Kasa. The person is suffering from Kasa, as we have discussed in the beginning. So it is the color of the sputum that determines the dosha dominance itself. Suppose if the person is having watery colored sputum, probably that may indicate vata pradhana kasa itself. If he is having the whitish colored sputum along with cough as such, it may indicate kapha dominance. If the person is having yellowish colored sputum or greenish colored sputum, that may indicate pitta dominance. If the person is having the blood mixed sputum, probably that may indicate either that is the all the tridosha involvement, or there may be a possibility of the presence of rakta in the the sputum itself. So this is what we can say. The dosha dominance can be assessed by this prameha. So that means the discoloration of this urine, in the sense yellowish colored urine may indicate pitta dominance. Whitish colored urine may indicate kapha dosha dominance. So like that, so this can be analyzed by Darshanendriya itself. Samsthana. For example, this is nothing but the clinical features. For example, the person is suffering from udara. Udara in the sense it may indicate the generalized abdominal swelling. We need to know just by looking into that, we can able to say what might be the possible cause of the illness as such. Suppose if the person is having lower abdominal swelling, and if it is associated with the reduced urine formation, probably this particular swelling may be due to urinary retention. In that way, the Darshanendriyataha Pariksha may helpful in the based on the clinical features. For example, Sandhishota. The person is suffering from the huge swelling of the knee joint. We need to know whether it is mild, moderate, or severe. Whether he is able to do his routine activities in that particular situation, maybe milder one. He is not able to do any kind of routine activity. He will be sitting for a long time, and whenever he changes the movement of the joint, he will be having severe pain aggravation. Again, that can be analyzed by Darshanendriya itself. The other aspect regarding the pramana, that means ati dirghata, to tallness of the individual, or ati hrasvata, to shortness of the individual, or ati lomata, much amount of the body hairs, and alomata, less body hairs, or the person is having the baldness, etc. That can be analyzed by the Darshanendriya itself. Then nourishment, regarding the degree of nourishment. For this, there is a specific description whether he is having the proper nourishment at all. He is undernourished. For this, you need to check the body mass index. Whether the body mass index is less than 18, it may indicate undernourishment. If it is 18 to 25, it may indicate normal body mass index. If it is more than 25, and if it is less than 30, it may indicate overnourishment. More than 30, it may indicate obesity. So like that, so this can be analyzed by Darshanendriya. Luster of the skin, such as skin turgor. For example, if the person is having the 20 times loose motion, he will be having the skin turgor that will be lost. That can be analyzed by Darshanendriya itself. Vit and Mutra, that means the discoloration in relation to urine and fecal matter. Suppose if the person is having the whitish colored fecal matter, this may indicate the absence of bile in the fecal matter. So that means the person may have hepatobiliary dysfunction, specifically post-hepatic dysfunction. Post-hepatic jaundice may be one of the feature as such. Suppose if the person is having the fecal matter mixed with the blood on the sides of the fecal matter, this may indicate the localized bruise on the rectum. So this can be, or there may be a possibility of the tear of the blood vessel in the anal canal. This is what the indication can be. Mutra discoloration. So that is yellowish discoloration or reddish discoloration, etc. Or the lymph type or yellowish dark thick passage of urine. This may indicate the presence of the lymph in the urine, etc. That can be analyzed only by the Darshanendriya. The Charaka says regarding Darshanendriyataha Pariksha. Varna samsthana pramanachchayaha Sharira prakriti vikarau chakshurvaishayikani yani cha anyanyuktani cha tani chakshusha pariksheta. It is being, if you split this particular shloka, Varna, Samsthana, Pramana, Chayaha, Sharira, Prakriti, Vikarau, Chakshuhu, Vaishayikani yani, Cha, Anyani, Uktani, Tani, Chakshusha, Pariksheta. So here it is being mentioned that the Varna, Samsthana, Pramana, Chaya, etc., that is being mentioned in the previous shloka. So here, Sharira, Prakriti, Vikarau, that is the appearance of what you say, that the normal and abnormal components or the signs of the body. For example, colorless urine may indicate normalcy. Yellowish coloration, yellowish discoloration of the urine may indicate pitta dosha dominance. Specifically, hepatobiliary dysfunction may be possible. If the person is having the reddish colored urine, there may be a possibility of urinary tract infection. Yellowish colored fecal matter, that may indicate the normal color of the fecal matter. If that is having the dark black colored fecal matter, may indicate constipation, or there may be a possibility of low, that is the gastric hemorrhage, etc. And normal right knee joint and abnormal left knee joint. Of course, this can be analyzed by Darshanendriyataha Pariksha itself. Sushruta says, Chakshurindriya Vidnyayaha Sharira Upachaya Apachaya Ayur Lakshana Balavarna Vikaradayah. It is even mentioned that Chakshu Indriya Vidnyayaha Sharira. That means the body and body parts has to be analyzed properly. Upachaya, that means nourishment. Apachaya, lack of nourishment. Ayu Lakshanaha, that means the signs of the life. Bala Varna Vikara Adayah. Bala Varna Vikaradayah. Any kind of the disturbances in relation to strength and the discoloration as such, that has to be analyzed by Darshanendriya. This one we will be examining with few examples. For example, in this particular occasion, right image, extreme left image shows the person is having the bleeding in the knee joint. So the probability, there may be a possibility of a external trauma. This may indicate the damage to the skin of the right knee joint. This can be analyzed by Darshanendriya itself. Whereas, look into the image of the left aspect. See the small kind of the blisters. They are being observed just above the eyebrow. Small blisters as such. Of course, this can be analyzed by Darshanendriya itself. When you think about the eye, the skin present below the medial canthus of the eye, here we can able to see the roughness of the skin itself. This is what we can able to analyze by Darshanendriya. Let us have one more example. So extreme left image, you can see the discoloration, etc. of the skin. Of course, it is of the small variety in the small area of the skin as such. This is analyzed by Darshanendriya. Whereas the right image, that is showing the rukshata of the skin, almost all parts of the body, except the face as such. This may indicate, this indication can be done by Darshanendriya itself. Take-home messages from today's discussion are: eye of the clinician or examiner is used to perform the Darshanendriyataha Pariksha. Here what we are going to assess is the status of nourishment, any kind of the discoloration, disfiguration, and anthropometric measurements are analyzed while doing this type of the Pariksha. When you think about the overall, the interpretation of this particular session is, don't see, simply observe the patient. See, the difference between see and observe is, see means we are going to see what we want to see. Whereas observation is the one that is looking into the signs, etc., which we are not thinking at all. So that means we have to develop the art of observation rather than art of seeing. For this, listen to the patient with 100% attention. This is very, very essential if you want to come out with any relevant physical examination findings. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in this particular channel? Mention in the comment box below and spread this particular video to the maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.